Recognizing that pharmacists are the true medication experts, Clarest is developing innovative technology solutions to streamline workflows, improve communication, and ultimately enhance patient well-being. It's really about empowering pharmacists to make a real difference in patients' lives. I hope you enjoy the program.
Because pharmacists are truly the kind of best educated experts in medication. All physicians know about medication, but they don't know the in-depth side of it. They don't study it like pharmacists do. And how do we do it with technology that makes it easier across the board as we look at transitions in care and care settings and where the patient is in their medical journey? Even 10 years ago, my parents would go to their pharmacist who would offer that level of expertise. But now we're in a different realm where the retail pharmacies have just gotten so big. And the retail pharmacists simply don't have the time to go as in-depth or as far as they maybe would like to, just because of the restrictions on the amount of time they have to serve every patient.
Right.
Medication really serves such a huge role in becoming well and being the best that you can be, no matter what your condition is.
There's a reason several people within this system spend several years trying to get educated in those specialized areas, and expecting a patient to understand all of that is obviously a huge burden and not realistic. You know, that's the end goal, is better patient care across the board through the entire patient's life. Using technology and communication with the patient to streamline those types of barriers with those patient and improve the patient care is really manage those care gaps and those adherence issues with that patient. We can say, you know, why aren't you taking this medication, and educate them that that's just a potential side effect and switch them to a different drug. So leveraging our internal tools in order to really see the patient picture as a whole and use our technology to see that whole picture really takes some burden off the patient in a really complex environment and allow us to address that patient care. That's exactly right. What we're able to do is really reduce steps and the burden on the pharmacist, being the clinician in that situation, having to rack their brain for.
And so again, to Megan's point, it kind of takes the guesswork out for those providers within that patient's care network, and offers that expertise to say, okay, here's the guidance on how to best manage their medication.
There isn't a automated process in the retail setting to call out those types of issues. It's all manual. And with something like MTM Path and how we leverage that tool, it is automated. It really increases the adherence for the patient because we keep that streamlined communication in and really try to improve their care and have a constant beat on it, which, unlike specialty providers or even your PCP, you see them once a year to get your meds renewed.
I think everything leads back to adherence, right? And if a patient is not adherent, it affects the pharmacist, it affects the provider, and most importantly, it affects the patient. How can we package this medication to make it easier, faster, better for the nurse who is administering those medications within that LTC environment? Because at the end of the day, as I said, all roads lead back to adherence, right? We can do all of these great things, but if the patient at the end of all of this, in their time that they are at home being cared for, are not adhering to their medications, it's still not going to work, right? So imagine you had all of these top level experts in one place giving the information to better plan for this patient. All of that is built into MTM Path in specialty programs.
I know vaping might not seem like it's the same thing as smoking, you know, a Marlboro Red like the old days, but it's an important factor and intervention that pharmacists can have. It's amazing what having additional outreach to somebody's home and calling them and talking to them, the difference that you make in that patient's care, more than just, oh, I went to my doctor once a year.
Right. The technology is there to make the pharmacist very much the center of all this.
Absolutely. Yeah.
That's the overall goal, is for them to feel empowered to be clinicians and not just putting out fires or filling prescriptions, but actually moving patient care forward.